Republican leaders in Texas showed their cards laying out a proposed congressional map, redistricted, that could help them gain 5 additional House seats in next year's midterm. The tactic dates back to our founding fathers. It's called gerrymandering. It's one that the president has publicly supported for weeks now.
I think we get 5, and there could be some other states. We're going to get another 3 or 4 or 5 in addition. Texas would be the biggest one, and
so
that'll be 5.
Are you calling then for a complete redrawing of the congressional map ahead of next year?
Just a very simple redrawing. We pick up 5 seats. But we have a couple of other states where we'll pick up seats also.
But Democrats control some states too, and they say, hey, not so fast. We're going to fight back and change our maps to our advantage in places such as California, Pelosi's home state. We're going to ask Speaker Pelosi about that, as well as Speaker Johnson. Good to see you, Speaker Pelosi. Let's start with redistricting, because Texas Republicans earlier today unveiled their highly anticipated map of how they would redraw districts in their state to basically flip 5 Democratic House seats, make them Republican. Under this map, for example, Democratic Congressman Greg Cesar's seat is completely eliminated. Congressman Henry Cuellar, Congressman Vicente Gonzalez's districts will be made more Trump-leaning. Now, Democratic governors, as I don't need to tell you, in places such as California, are vowing to fight this tit for tat. Do you support that? Should California respond with their own redistricted map to give Democrats more seats?
Yes, but before I go into that, let me just say that what you just described was the elimination of many minority seats in Texas. And that's unfortunate, because the gerrymandering that they're doing is also undermining the diversity that we need to have in the Congress. As far as California is concerned, we would go to a commission. We have a commission-based redistricting. Instead of the gerrymandering that they're doing in Texas, we've had a commission that has drawn the lines in California. We would alter that a bit in order to pick up the seats that we need. It's not necessary if Texas doesn't do this, but the Texas redistricting and what the president has talked about in other parts in the country is indicative of the poverty of ideas that the Republicans have, and they have to resort to this kind of gimmickry in order to try to hold the House. But we will hold the House, and we will participate in California if Texas decides to go forward.
Your governor, Gavin Newsom, said that the 2026 election is being rigged by the Republicans. Is that how you see it?
Absolutely, absolutely. But it's who they are. But again, so much is at stake in this election. We fully intend to take back the House. We only need about 3 seats. I want 30, of course. And they know that. That's why they have to go into this rigging process. But we will, again, we have the capacity to have more seats in California. We can win them in the election, or we can ensure them in the change in the commission. Now, with the caveat that the commission would, in the next redistricting, go back to drawing the lines.
Multiple Democratic sources say that Texas Republicans' proposed new congressional map shows Republicans are indeed trying to gain 5 more congressional seats through partisan gerrymandering, which could help them hold on to their narrow majority in the 2026 midterm elections. Democratic governors in some states, such as California, are vowing to do the same. One Democratic lawmaker describing it as a redistricting arms race. Today, Vice President J.D. Vance tweeted, "The gerrymander in California is outrageous. Of their 2 congressional districts, 9 of them are Republican. That means 17% of their delegation is Republican. When Republicans regularly win 40% of the vote in that state, how can this possibly be allowed?" Unquote. And this drew a reply from California Governor Gavin Newsom, who wrote, "Try again, dum-dum," unquote, with an image of a map that shows that the most gerrymandered states are, in fact, Republican ones. If you look closely at that, you'll see that there is an exception there for Illinois, which is quite gerrymandered. House Speaker Mike Johnson joins us now from Bossier City, Louisiana, where he just met with his constituents and community leaders and business owners. Speaker Johnson, good to have you on the show again. It's been a while. Wanted to get your response. Speaker Pelosi said that if indeed Texas goes through with this plan, then California will respond in kind.
Hey, Jay, great to be with you. Yes, coming to you from 4th District of Louisiana here. I've been working through the district throughout the day, and everybody's watching all this closely. I'll tell you that the redistricting is the responsibility, it's the prerogative of the states, and so not really my lane. But I would take issue with what Speaker Pelosi said, is that apparently, I think California, by my understanding, they have to amend their constitution to redistrict again. So we'll see what happens in Texas and around the country. I'll tell you this, Jake, I am confident that when it comes to these congressional seats, we can win any seat in any district in America because we have a great story to tell in the midterm election, and I'm very bullish about the outcome, regardless of how the redistricting comes out.
Well, let me just ask you. I get that it's an issue that the states get to make. But instead of having an arms race on redistricting, which is what it looks like we're about to have, would it not theoretically be better for every state to have an independent commission so that voters get to pick their members of Congress instead of members of Congress getting to pick their voters? Wouldn't that theoretically be a better goal?
Well, the devil's always in the details, Jake. I mean, some of these blue states have had commissions, and they have worked out so that they've eliminated Republican seats in their states. We've already seen that in some of the states around the country. So I'm not sure that's the solution either. I tell you what, I will work with whatever we have at the end of the day. We have a solid, hardworking Republican majority in the House right now and the Senate. We're delivering for the people, and I'm very excited to go out and tell that story. I'm very excited about the midterm election. You know that we're going to defy history when we grow the majority in the House, because it's only twice in the last 90 years that a sitting president has picked up seats for his party in that first election cycle, but we're going to do it this time. We have a very favorable map, regardless of how well this comes out. And we have policies that we're delivering on our promises for the people. That's going to make all the difference.
Well, let's talk about that, because moments ago at your event in Louisiana, you praised all the work that went into passing Trump's so-called Big Beautiful Bill Act. Let's discuss one part of the bill that greatly impacts your state. The Urban Institute estimates that 116,000 to 132,000 Louisiana adults could lose Medicaid because of the new federal work requirement. And the executive director of the Louisiana Rural Hospital Coalition this week told WRKF that hospital closures are likely because of this legislation. Take a listen.
If you reduce what Medicaid is paying, there's less money for the providers to provide services to everybody, to expand services, to have access and capacity. If a hospital shut down, that shuts down for everybody, whether you have private insurance or Medicaid or Medicare.
He said before those cuts take effect, federal and state leaders need to come up with a plan to keep rural hospitals afloat. I'm sure you care a lot about that. So what's the plan?
Jake, there's a lot of misinformation out there. Let me take those in turn. The first one, you said it was the Urban League that came out with their study, said 100,000 plus people are going to lose Medicaid because of the work requirements. Then that means they're choosing to not work, okay? Think about what we put into the bill. This is a very important reform that is about 90% in public opinion polls. If you have able-bodied workers, young men, for example, without dependents, they need to be working, not riding the wagon. We only instituted in the bill, Jake, 20 hours a week, 20 hours to work, be looking for a job, be in a work training program, or volunteer in your community. Who can't do that? So if somebody drops out of the program because they're unwilling to do that, they did not deserve to be on that program in the beginning. And I will take that to any town hall in America, anywhere, and explain it. They made that choice. That's about 1.7 million people you're talking about, or about 4.7 million people, in fact. But also, we've got the illegal aliens out of Medicaid. That's 1.4 million people, and about 1.2 are people that were receiving Medicaid from multiple states at the same time, gaming the system, cheating the system. We had to do these reforms to shore up the programs, to strengthen them for the people that need it most. We're in the 60th anniversary of Medicaid and Medicare. Medicaid was intended for young, single, pregnant women, for the disabled and the elderly, not for people who could be working and are not doing it. They shouldn't be riding the wagon. With regard to the rural hospitals, Jake, there's a lot of misinformation out there as well. We did not cut Medicaid, and we did not cut the funding for the rural hospitals. In fact, in the Big Beautiful Bill, as you know, there's a big fund, a $50 billion fund for the rural hospitals and underserved hospitals, and we built in flexibility for the states to be able to work out their funding mechanisms. So there's a lot of alarm and a lot of misinformation out there right now that's just simply not true. And the reason I'm looking forward to that midterm election is because we'll be able to tell the truth, that people will see the results of this, and they're going to vote accordingly.